Hey guys, it's Jana Price. Thanks again for joining me on this episode of Nurse Converse. I am beyond excited not only to have somebody from my hometown in the South, but to have Courtnee Stagner on. A lot of you're going to know Courtnee because she and her husband do some pretty funny content. If you've seen the funny nurse holding up the signs and her husband trying to guess, well, this is your girl right here. This is Courtnee.
It's me.
Thanks for joining us today, Courtnee.
Thank you for having me.
Absolutely. All right, guys. So while Courtnee is a funny gal, she's actually got a great story in nursing. And we're going to touch on some subjects today that are funny, but we're also going to be talking about what Courtnee is really passionate about, and that's palliative care and nursing. Courtnee, I want you to go ahead and start out and tell us what is your current role in nursing. And before we get started, I do want to congratulate you because Courtnee is expecting a baby here shortly. So,
thank you.
Congratulations. And so start us out and tell us what you're doing right now currently in nursing.
Right now, I graduated with my family nurse practitioner and my psych mental health nurse practitioner back in 2018. Ever since I became a nurse practitioner, I have worked in hospice or palliative care. I am currently a palliative care consult here in Mobile. I go around, have goals of care conversations with families, patients that have been in the hospital a long time, have really unfortunate diagnoses. They just have to figure out what their next steps are going to be, and we just kind of lay out the options for them going forward about services that we can offer outside of the hospital or inside the hospital if they're too unstable.
Now, where did you know you always wanted to do this? Is this where you started out?
To be honest, I always tell people I came from a critical care background. I did cardiac ICU, open heart, medical ICU. Critical care was my area. That is where I love to be. Then hospice kind of found me. I had just had my son Jackson, and I was looking for like a part-time position. Hospice offered me a position that, was suitable for my schedule. I was able to raise my child, and I was like, I don't know about this hospice. Like, I went from critical care, taking care of all these drips and things, to just saying, let it go, just let's stop everything. Because that was my thought about what hospice and palliative care was. And ever since then, I learned more. I've seen the benefit of it, and I've fallen in love with it. I've seen the need, and that is my passion now. I am in deep with palliative care.
With palliative care. That's awesome. All of us nurses out there, if you've worked in really any form of critical inpatient care, we're coming across that moment. Death is a part of life. And
yes,
having a nurse who, it is a special calling, because in those moments of passing, the family not only is important to the patient, but it's so important to the family. You are not only treating the patient, you're equally as much caring for that family. And I think it's a gift and a calling to look at it that way, not say, I am just strictly here to pass these medicines or, provide care that's for this patient. However many people are in that room, if they happen to be there or during the process, you're providing nursing care to them as well. And you're using so many skills that you come from nursing. Do you feel for our younger nurses listening out there and maybe who are thinking about going into this field, what would you say if they're interested in this, learn in that critical care or whatever field they're in right now? What can they take from this? How can they learn from their med-surg, their critical care, going into palliative care? What are some critical things that they need to pick up and learn before they step into this role?
In my experience, when I was in critical care, even med-surg, I did a little bit of med-surg too, is that patient has a life outside of that hospital. I always would ask them now, before, not so much, because I felt like I was just treating machines. I was treating values. That person is a soul, and they have family members that love them. And if their family starts reacting in a certain way, it's honestly just a grief. It's kind of a showing of grief. It is completely appropriate. Sometimes everybody shows that differently, but that person, you want to see what's valuable to that patient. Always ask them, what is your priority in this life? If you could get out of this hospital, what do you enjoy doing? And so I always treat everybody as a human now. Like sometimes nursing, you get to where you're just going through the motions. I hate to say that, but I mean, in order for us to be emotionally stable, we kind of have to put a block on those emotions and not get too attached to people. But it really does help when you know what they care about, who cares about them, what they do outside of the hospital. Those things just kind of make them, that just brings the humanity to that patient. So I always start by asking them, what is important to you in your life? And just start the conversation there.
Absolutely. Are there any specific times that you can remember something or a patient that just really touched you, or a situation that touched you that drove home, this is where I'm supposed to be and this is what I'm supposed to be doing?
Recently, I would say all of my hospice patients, I did inpatient hospice, but I really didn't get to talk to them much. But ever since I've been in the hospital and having more goals of care discussions, there there are patients that weigh heavily on me, and they're the patients that get the bad news really quickly. And I just had one recently last week who had that sense of impending doom, and their only wish was to get out of the hospital and see their dog. And this patient kept asking us, when am I getting out? When am I getting out? And we just kept telling them, hold on. We've got to get everything set up for your discharge. You will see your dog. You will feel your dog. As soon as he got out, saw his dog, and he passed away within hours after that. And it was just like that. The patients know when they're going to die a lot of times. They know, they have this sense of impending doom. And it's like whenever they tell you, I always have patients tell me, this is when I'm not going to be here this day. You always listen to that because they know what's going on with them a lot of times. But it's just those patients, it's not just this particular one, but there's a lot of patients that are like, you've got to get me out of here. You've got to listen to those patients, because if they do not want to die in a hospital, you've got to make that happen. And most of the time, as soon as you get them out, they pass away. And it's a beautiful, I mean, I think that would be, that's the best case scenario in there, in that setting. That is not the place that they want to die, but I think that's the best scenario that could possibly happen for them, is to get out, pass away.
Wow.
Because that was their wish.
Absolutely. I think it's important you bring that up, because even for people who are not nurses, or let's say that they're new or they're not in this field, I myself just recently had a close friend's family member pass away, and hospice was such an absolute huge help. I look back and I think, wow, what a gift and a blessing for a nurse to be able to come in and guide them not only through the medicine part of it, but everything, like you're saying, those important life things on the outside. That's such a skill, and it's something that it takes a special nurse. So that's what I want to ask is, let's say that you're speaking to somebody out there right now. Somebody is hearing this. Somebody is either in your role or wanting to be in your role. How do you get here? What advice can you give to nurses that show us the steps? How do you become a palliative care practitioner?
I ended up being very blessed to be in my position, but if you want to pursue palliative care, there's a lot of hospice companies, and then there are palliative care companies around, but you definitely have to have a passion for it, understand that death is inevitable, and be okay with prescribing certain medications and things like that. Prognostication is a big thing, but most areas should have palliative care companies around, and they want nurses who are very good communicators, love to talk to people, and just be there for the family whenever, as a support system. You're almost like a therapist instead of a nurse when you're going into these homes and things. There's not a lot of inpatient palliative care or clinics and things like that around. Palliative care is one of those specialties that really needs a lot more clinics and experts and things like that around. We're trying to get it built up here in my city locally, but I would just say start with a hospice company and go from there, because a lot of these hospice companies work with palliative care companies to kind of get that bridge going from palliative care to hospice. So I would just ask around. And if that is your passion, you'll know right away if it is something you want to stick with.
Would you say that I hate to use the word shortage because it feels like everything in nursing is short right now. Is this an area that needs more people? Do we need more nurses to get into this field in order to make a difference in those patients who are at the end of their days?
I think so. I just went to, I think it was back in last year sometime in the beginning of the fall. I went to a conference up in Montgomery, Alabama, and met with some of their hospice and palliative care specialists. That it was a board, and they wanted, obviously you want to start with your local politics and congressmen and things like that to try to get grants. But yes, it is a shortage. I found out that day that, I mean, thankfully, when I was certified as an advanced hospice and palliative nurse practitioner a couple years ago, I was one of 12 in the state of Alabama.
Oh, wow.
Now I'm one of 22, so that's good. But yes, there is, because a lot of people, you got to think death is a taboo. And so when people think palliative care and hospice, they think they're the same thing. So a lot of people are like, that just doesn't sound good. It sounds like it's depressing, like it's morbid. I don't think I would do well. It's sad. But in reality, you're helping these people live. Their time is limited. So honestly, I told somebody the other day, I was like, hospice, as odd as it sounds, it helps you live.
Wow.
It helps you live your life. You're not attached to machines. You're not attached to this hospital room. It's helping you live the life that you want to without having to go to the doctor. You've kind of accepted where your body is and go from there. But yes, there is a huge need. I think in the South, especially just based off my experience, it's the Bible Belt. And a lot of people think that healing is always on earth. And I always want to think death is coming for all of us. It's just, how do you want to spend those last days? And so it's very hard to get these really Southern, religious people to understand that all healing is not earthly. And I don't want to sound like I'm, bashing their hope or anything. We all have hope. But I always say, if God's going to perform a miracle, he can do it, whether it's in this hospital, at home, at a nursing home, at a hospice facility. But you don't want to take the chance of somebody dying in the hospital. But it's just, I think that it's more progressive and more accepted in like the northeast states, even in the West Coast and things like that. But down here where I am, it is a huge need, a huge shortage. And it's mainly due to people just wanting to fight. They feel like they're giving up if they don't. So, yes, I would say there is a lack of services especially where I am here, and I think nationwide, honestly.
I hate to say it, the sicker this is a very sick country. We have very sick patients, and we are.
Yes.
People are on their way out.
Yes.
We see it all the time as nurses. We know there's no sugarcoating it. People are sicker than they've ever been, and death is coming. So to have, like you said, I love how you said you're living. Palliative care is living and letting you live out what you have left of your life, doing what you want to do, not attached to a machine, not in a doctor's office, and not in a hospital, which is fabulous. One thing you brought up, a taboo, and I want to talk about it because I think this will be some good education, and I know you've got some good info. Let's talk about morphine and dying.
Okay.
It is a taboo, and me being
South,
it is a lot of people have a lot of questions, and even a lot of new nurses. When I was still at Bedside, which wasn't that long ago, many of my nurses could not wrap their mind around us giving morphine to somebody who's dying. So clear that up for us. Tell us about it.
So morphine is an opioid. It is used in hospice because it works the best to relax the body. It helps with what we call air hunger, respiratory distress, tells the body calm down, relax. It's a vasodilator, so it opens up those vessels, allows your lungs to get a good deep breath instead of panting. And a lot of times the stigma around morphine is that it hastens death. It speeds things up. in reality, if we start early, like for example, COPD patients, when they're put on hospice, they are the most air hungry patients that we're going to have. Those patients with a low dose morphine, they do very well. They are still awake, their air hunger is calmed down, but then the problem is they're scared that because of the stigma, they won't take it. Then they get into a crisis. That crisis wears their body out. They are literally in the last hours of their life. So we're having to give way more morphine because they're in that crisis. Then they die because they are so exhausted. The reason that we want to start early is because we don't want your body to get into a crisis. They are running a marathon, even if they're just laying in the bed, they're panting, breathing 40 times a minute. Their heart rate's in the 140s. That's going to wear somebody out. Just looking at those patients makes me tired.
Absolutely.
So the more, we always say to any of our patients, it is better to get ahead of the pain than it is to chase the pain. It's the same thing with the dying process. That morphine is not killing that patient. The terminal illness that got them onto hospice is killing that patient. It's just, how do you want them to die? Do you want them to die panting, running a marathon, worn out, uncomfortable, or do you want them to die peacefully? And that's kind of the two roads that we see. And a lot of times when patients, families and patients, they listen to us and they do start early, their life is lengthened because they are not so worn out. So I love it. Any opioid really. Dilaudid can be used, fentanyl can be used, but morphine comes in different forms, a pill, a liquid. I've heard some people do suppositories, injections, but it is the least potent of the opioids that hospice uses, but people think that it's, we're going to give it and just try to sedate the patient, and that's not the case.
Right.
It is a wonderful drug.
The help. Absolutely. That has been my experience in practice. And as a new nurse, I was terrified to use it because of this fear. And you so eloquently explained it for anybody out there. Most nurses are going to know, but for the new ones or just coming on, it's so important. Your only job is to advocate for the patient and make sure that they're comfortable. And in those situations, it's a lot of time handling family. The family's very scared.
Yes.
And to a lot of people, dying is scary. It's a very scary process because it's unknown, and we only do it once in life, right? So It's very unknown. For the new nurses out there, or for anybody who struggles with this, what is advice that you can give to those families who are struggling? What is the information or resources or just your best advice that you can give on how to deal with the patients who are struggling with what you said earlier is an intense amount of grief?
So I always start with death is inevitable, just like you said, it is inevitable. I always start with whenever we keep trying to avoid death, is that really doing something for this patient? Is it really doing something for us internally, or is it actually helping the patient? So a lot of times these people will keep going to the doctor, keep going to the hospital, trying to get these things done. And it's like the patient is not benefiting from it, or they're getting worse. And I always just tell them to take a step back and look, why are we doing this? What are our expectations? What are we thinking is going to be the outcome here? Because all of these doctors have already, pretty much referred you to hospice, and this patient is not getting better. Wouldn't you want them to have a better quality of life comfortably in the setting of their own home, surrounded by their loved ones? Or would you rather them die with us around them without you at 2:00 in the morning? And that's really, that kind of opens up their eyes a little bit whenever I say, how do you think that this has improved them? Because they've been hospitalized every month for the past 6 months. Do you see any benefit to the treatment that they're getting? And usually they would say no. But I always say death is inevitable. And if we know that our time is limited, how do you want to spend that time? How would you want your loved one to spend that time? How would they, if they can't answer for themselves, how would they want to spend their time? And typically you can kind of get down to to the root of everything. I'm just being, a lot of people say, I'm just being selfish. I know this isn't right. But I always say, that's why I always tell people advanced directives are necessary. Do them early. I have one. My social worker has one, and I'll be 35. So I don't, and talk to your family about it. It's not something that you should think is taboo, because anything can happen to any of us, but you want to know the wishes of that person. That way, the choice, you're just their voice box. You're the tool that the doctors or the professionals are going to be using to get their wishes known. But talk about it early, because you never want to be second guessing. And then the grief is 10 times worse if you think, I should have done this instead of this, or I should have done this instead of this. Those what ifs are going to be there no matter what. Just kind of leave it be. But I encourage everybody to talk about it with their loved ones, especially if they're getting up there in age or their health is failing. You want to know, and it is not going to jinx anything. A lot of people think that if I talk about it, it'll jinx,
Right.
But I talk about it all the time. My husband gets on to me because he's like, you are so morbid. I'm like, no, I know that death is coming, and I could walk out of the store, get my car, and be hit. Like, I'm prepared. I want you to be prepared for that if that happens to me. So it is very important. We love the people that have advanced directives and have these conversations. It makes it 10 times easier, and the grief is a lot less.
Absolutely. And then I feel in my own family, almost everyone has had some form of advanced directive, and it's made process no less sad. Of course,
Right.
it's sad, and the people passing, it is a sad moment. But when things are, for a lacking of words here, we're buttoned up, to use for lack of a better saying, you're able to get past those things and move on to talking about the memories and maybe lessen some of the fights and some of the issues. So I so appreciate you saying that. Even as nurses ourselves, we see it, we know, and it's so important for even us to have advanced directives. If we're going to tell our patients to have advanced directives, we too should have advanced directives, because we know
Yes.
that in the end, all it is letting people know it's your plan of care. It's no different than if you have, say, diabetes, or you're going to get a frequent hospitalization for, say, sickle cell crisis or something like that. You're literally saying, I know that what's going to happen, and it's inevitable, and this is the plan that I would like you to follow. And we're not jinxing ourselves. So
no, it's just like any discharge plan, but it's
the celestial.
A lot of nurses say celestial discharge.
Yeah, the final discharge, which we're all
right.
face. So, and this is a one that we all face, and this is really going to get in there with you on this one, because I think it's just important. Dying is a very cultural process too, religious, cultural, and there have been, I remember almost wanting to fight a charge nurse when I was very young, because I had a patient, I believe that they were, I'm going to say it was Hindu, and the family I apologize if I'm wrong out there. I cannot quite remember. I was much younger, and my brain had, was a lot better without teenagers and 10 years of nursing. So excuse me, but for whatever reason, their culture did not allow the body to be moved for, I believe, 8 hours after they had passed.
Mm-hmm.
And you already know administration had a heart attack, because hello, we need that bed. But the family was coming, and it was so important to have that family member stay in that room. And I remember thinking, I was so young, and that we have to move them. Can we take them down the hall? The family was adamant. And I remember it was one of the very first times I stood up and said, no. Did I have the patient's religion? No. But that was my patient, and this is what they wanted.
Mm-hmm.
I was there to advocate for them. And no, I don't care if you need the bed turn. I know ER's fallen everywhere and there's people piling up, but this is this person's dying wish, and this is their family's wish. What advice can you give to nurses who, A, may have conflicting beliefs, B, are fighting administration over honoring the wishes of those who have passed in their care in the hospital setting?
Yes, we've had several, which of course, like I said, I'm in the Bible Belt, so most people identify as Christian here. But I have had a patient who was Muslim, who their beard could not be trimmed or anything like that. Like post-mortem baths, usually our aides would shave them, get them all cleaned up for the funeral home. But you got to think, if that patient, they are saying you can't touch them, it's probably related to where their soul is going. So despite what you think your policy is, that is going to have a profound impact on what they feel like their soul is going to be damned to a place that they didn't want it to go, or it shouldn't have gone because of you. You have created an absolute traumatic experience for the rest of their life. They will remember that hospital and remember you and remember your administration for the rest of their life as ruining the death of their loved one.
Right.
What could have been a beautiful experience, administration or whoever has made it an absolute trauma. Everybody has the right to their religious beliefs, and however they want, that is part of their advanced directive. Because religion is a huge part of death. Spirituality, I always say death is one of the most spiritual things ever. And if you cause chaos in that, it is absolutely, it's not just traumatic for that patient's family, but the nurses around who really can't do anything about it. Everybody will remember that experience as a horrible one for the rest of their life. It's just allow people to have their spiritual beliefs, no matter if the ER, those patients, you're going to be backed up no matter what. That is something that will continue because we're in healthcare. But if it's for the sake of a beautiful experience for those patients, let them have it.
Right.
Just let them have it. And you need to fight, just like you did. You stood up, you fought. I would do the same, even if I did not have the same beliefs as these patients. You don't have to participate in their ceremony. Just allow them to do it. This is what makes them comfortable, and this is part of the dying experience. So it should be allowed, no matter what.
Advocate for your patients. It's just so important. And, bringing up, I know I follow you on Instagram and TikTok. And so we're going to shift gears a little bit here. And I want to go into something here first with, I know that you're very vocal about your religious and spiritual beliefs. And how has that shaped how you practice in a part of nursing that is death? How does that shape how you approach your patients and how, where it's brought you this far?
Like I mentioned before, most of the beliefs on death and dying here are based off of earthly healing. And so if I know that I have the same religious beliefs, Christianity, as these families or patients, and God's going to heal me on earth, I always kind of bring back, I read the Bible. I've asked them, have you read the Bible? Do you remember the story of Lazarus? He rose from the dead, but he died again. All of us, we're not meant to all have earthly healing. And I try to bring out a common ground here and try to use it to kind of reshape their thinking process, because a lot of people think it's just giving up hope. I'm giving up, I'm killing them if I don't. But I always say medicine and resuscitative measures, honestly, were for the patients who have had traumas to allow their body to heal on a ventilator, to rest. They didn't have chronic progressive lung disease, chronic progressive heart failure. All of these things will not fix what's going on here. So it just causes and inflicts more trauma. And so I try to get them to think, like, what are we doing here if we're fight? Also, I don't want your vision or your thought of God to be tainted because your faith is so strong that he's going to be healed in an earthly, a physical basis. I don't want that to skew your faith. I don't want it to topple over because you believe so deeply that this patient is going to be healed. And I was like, but healing happens in eternity. We're going to have a brand new body when we walk through those pearly gates. Allow that. I always say allow that. And I believe I posted a TikTok video probably a couple weeks ago about this. The most religious, faith-based people are so just aggressive, aggressive, aggressive. They will not let their loved one die a natural death. And I was just like, why? I just couldn't wrap my head around it. And I wanted people's opinions on it. And it's just part of our humanity. We are human. We want to be selfish. We want to keep those people close to us. But is that really our loved one on that machine, or is it that machine that's breathing for them? I don't want to keep my loved one on this earth in suffering when I could just let him go and be with the Lord.
Right.
And that's just, I just try to have that common ground, and I just tell them I have the same, I'm a Christian, but let's talk this out. I'm going to share my beliefs with you from the Bible. I give you, I give them passages from the Bible, stories from the Bible, and a lot of times they feel comfortable because I am comfortable enough to share my religious beliefs. I'm not just thinking that man is in control. And a lot of times that is also an issue. They think, oh, you know more than God, you're trying to play God. But I'm like, who's actually playing God here? Is it me, or is it this machine that we're pumping air into these lungs? We are sustaining them.
Right.
So it does help, especially in my area. Now, if they don't have the same beliefs that I do, I just strictly statistics and experiences and what's going on, just physical things. That's where my science brain just kicks on. But most of the time, people, I would say 90% of the patients that I see in the hospital have a faith-based background that are very similar to mine.
Right. And I already know that no matter what, we treat them with respect. We love them no matter what. And I know you have such a really great following, and your content is really awesome and encouraging and funny. And you're very vocal about how you're so accepting and you're so loving. And it's just, honestly, you have such a great disposition and really encouraging and loving. And which brings me to, I gotta ask, and we're gonna shift here. So, with your husband and doing the funny TikToks that came about, holding up the signs of the craziest guys. If you haven't seen, she holds up a sign behind her husband, and he is of no medical background. Am I correct?
No. You would not want him to touch you in a medical setting.
He's a comedian by profession.
Yes, he was a steel mill worker, but he is now a full-time content creator and comedian.
And he has to guess or spell out and pronounce, number one, the word, and then guess what it actually means. And when I tell you, I have laughed so hard to the point of tears. And what is one of the funniest medical words and explanations that he's ever given? What do you think is the funniest?
Oh, man. I'm trying to think. I think it was rhinorrhea. I put up rhinorrhea on the board. And he says, it sounds like Scooby-Doo saying gonorrhea. He's like, rhinorrhea. I was like, oh, my gosh. How does he? And some people have asked me, is it scripted? Have we come up with these? He has no idea what word I'm choosing. I write it, and he honestly has to read it backwards, and he just comes up with, that's how you know that he was destined to be what he is, because his brain works the opposite of my brain. I'm so literal and concrete, not creative when it comes to things like that. He takes it away.
Oh, it's so funny. And I love that you really have both sides. You're dealing in palliative, which is such a complex and serious kind of area, but then you come out and you have the funniest content. So it's like you have the best of both worlds. And I feel like in where we are in nursing today, I love that you brought this content today where it was educating. We're learning a lot about something that has to be addressed in nursing. It's a field that we need to spend time on. We need to know more about. But at the end of the day, you walk away and you give us some hilarious, hilarious content as well as educational. So we appreciate that a lot. So
And I appreciate everybody for watching.
thank you for coming on today. Where can we find you on TikTok, and where can we find you on any other of your socials, Instagram?
TikTok is Courtnee Stagner 12, and Instagram is at Courtnee Stagner.
Okay.
I should be the only Courtnee with 2 E's that pops up usually.
Awesome. Thank you. And is there's any advice? Is there just in nursing? We have these young ones that we're bringing up, but then we have the nurses out there who are just burnt out. We're all going through it. It's just a tough time. What kind of encouragement can you give to anybody out there listening who's struggling, who needs a moment of encouragement?
You got to find a hobby a way to decompress, whether that be through faith-based scripture reading, meditation, self-care. Take those PDO days, take vacations. Do not overwork yourself. That is a concoction, a recipe for disaster. You've got to give yourself a break and just know you do everything you can for your patients. Do the right thing, advocate for them. Know that just because they're a physician doesn't mean they always have the best interests of the patient. You be their voice, you advocate for them. And when you go to sleep at the end of the day and you close your eyes, you say, I did the best I can, and just leave it at that. You're only one person. This is a flawed system. We are trying to fix it, but you do what's best for your patient and you take care of yourself, because if you cannot pour from an empty cup. You've got to take your days off. You've got to decompress at the end of the day and just try to forget what happened on that shift until you have to go back to work the next time.
It'll be there again. It will be there again.
Yes. So, it'll be a whole different situation.
Live your life while you have it and live it to the fullest.
Yes.
So, absolutely. Again, Courtnee, thank you for coming on today. It's been such a pleasure. And guys, if you have not seen her content, if you need a good laugh and a good encouragement, Courtnee is definitely your girl. So thanks again.
Thank you.
All right, guys, until next time, you guys have some great shifts and stay safe out there. Bye, guys.
Bye.